Beginning to look a lot like
Welcome back to Washington Watch. My name is Joseph Backholm. I'm sitting in for Tony this week. Hope that you are ready for the holidays, or soon will be. A couple reminders for you. You can find this in every program at tonyperkins.com. In addition, a great opportunity to have your contribution to Family Research Council doubled. Any gift given at tonyperkins.com before December 31st will be doubled. This program and everything Family Research Council does is dependent entirely upon the support and generosity of friends like you, and we are grateful for it. Now, I wanted to pick up one final point, our last segment in the conversation we had with Mary Beth Waddell, on the way that the language that would have forced women to be in the draft was stripped out of the NDAA at the last minute. And she made the point, and I want to underscore this point, that there were over 200,000 people who reached out to their members of Congress through the Family Research Council and resources that were distributed to good folks like you who took the time, a handful of seconds, to make a phone call, to send an email, in some cases to make a personal visit, to communicate with their members of Congress how they felt about that issue. And ultimately, that is what made the difference in that piece of legislation. And it is so important that each of you understand how important your role is in the policy-making process. It is easy to be cynical about what happens in Washington, D.C. And no, the public does not make a difference on every single issue. But understand that as challenging as Washington, D.C. is, it would be so much more challenging if each one of us quit trying because we were frustrated with the results. And that's just one. It's just a small, but it's a very real example how even in a difficult Congress with a challenging administration, you can get things done simply by proving that you care. Because ultimately, when you're dealing with elected officials, the thing they care about most, in most cases, is keeping their jobs and staying in office. And enough communication from their constituents can give them pause about whether what they're going to do is worth the price they could pay when they have heard loudly and clearly from their constituents that their constituents are not excited about that. So if you are not connected to FRC's other communication channels, I would encourage you to go to frc.com and sign up for the alerts, for the email alerts, for the text alerts, however you like to get that information, so that you can make sure you are in the loop and you are helping, along with your friends and neighbors, make a difference on this issue. Now, as I shared at the top of today's show, President Biden earlier this afternoon laid out his latest plan to address the rise in COVID. And there was a change in tone, and we talked about this at the top of the program. We talked about the fact that yesterday the White House was sending out messaging essentially threatening people who had not been vaccinated and painting a very grim picture of what the future might look like for them. To his credit, President Biden seemed more measured today, and he told people not to panic. And we've discussed how some of the other communications may suggest that he was encouraging panic. But the fact that he was saying, at least out of one side of his mouth, don't panic, was a good thing, because he did run for office trying to be a divider. Trying to be a uniter, excuse me. But here was his message to the nation as people across America headed into the holidays.
So, folks, let me summarize. We should all be concerned about Omicron, but not panicked. If you're fully vaccinated, and especially if you got your booster shot, you are highly protected. And if you're unvaccinated, you're at a higher risk of getting severely ill from COVID-19, getting hospitalized, and even dying. So the best thing to do is get fully vaccinated and get your booster shot.
Joining me now to talk about the president's response to what is now the dominant strain of COVID, the Omicron variant, is Dr. Andrew Bostom, a clinical trialist and associate professor of family medicine at Brown University. Dr. Bostom, welcome back to the show.
Thanks for having me on.
Now, I don't know if you had a chance to actually watch the comments, but do you have a reaction to them?
I'm just seeing them now. I didn't have a chance to react. I agree with you. You know, a positive aspect of the comments is some of the reassuring things he said. But the last statement that I'm just watching now about the unvaccinated is just misleading and false. Look, we have data confirmed from the CDC. It's a small sample of the initial infections in the United States, but we have much larger samples, for example, from Denmark, showing that we're running roughly 80% of the people that are infected with the Omicron variant are fully vaccinated, and that group includes people that are boosted. And the real important message about Omicron, regardless of vaccination status, is that we have clinical measures now, clinical outcome measures now. In South Africa, which was the epicenter of the Omicron wave, and by the way, it's receding now already quickly in South Africa. They noticed that their severe morbidity admissions were down by about tenfold. They were 1/10 of what they were during previous waves. We're seeing in Denmark, they've now characterized about 18,000 Omicron cases, and they're seeing a 60% reduction in hospitalizations relative to previous waves. You know, people can argue that South Africa is a much younger demographic. You can't argue the same when it comes to Denmark. These are important, reassuring things that also needed to be added to the discussion. And I will say it's an early report, but at the end of last week, you know, sewage samples are monitored for the presence of COVID, of the coronavirus. You can see, again, now mirroring what the CDC is telling us, that 73% of the new cases are Omicron variant. The Orlando sewage system, and I guess it was really samples from the whole district where Orlando is in Providence. In Florida. It's Orange County. They claimed that it was 100% Omicron, and yet they were still not seeing any significant uptick in Orange County, Florida, in hospitalizations.
Dr. Boston?
So there's a lot of reassuring information out there.
And that is good news, and that though this is clearly spreading quickly, that it seems to be less severe, but does the speed of the spread, despite the prevalence of the vaccine, indicate that the vaccine really is, with respect to Omicron, simply something that will mitigate the impact rather than stop the spread?
Well, it's clear that it's not stopping the spread. When you see 80% of the positive tests, the so-called cases, are vaccinated to some extent or another. You know, the old standard for full vaccination, 2 shots, the new standard being boosted. So it's clearly not doing anything to prevent spread. Whether it's having a positive impact on people who are high risk in terms of preventing severe morbidity and, God forbid, mortality, certainly that's possible. However, once again, omitted from the discussion is the vast pool of people who've been previously infected, who have naturally acquired immunity. And what I can tell you from Denmark is that those people are barely even getting infected. When they looked at their sampling in Denmark, only 4.3%, as opposed of the people being infected with Omicron, had a history of prior infection. Again, they're running about 80% have been fully vaccinated. So, you know, again, this really anti-scientific exclusion of natural immunity from the equation is really starting to become quite distressing. You know, either we're going to deal with the actual science, or we're going to descend into Soviet-era Lysenkoism, and that's my real concern.
Now, Dr. Boston, one of the things that President Biden addressed today. As we know, the vaccine is being rolled out based on age, and there are some who are still not eligible for it. And this is what President Biden had to say about children getting the vaccine.
Get your children protected today, now. For those parents out there who have a child that's too young to be vaccinated, that is under the age of 5, I know this can still be a scary time.
Well, that's an obscenity. I'm sorry. We have to start talking frankly about this. That's an obscenity. The healthy child has almost zero risk from COVID, and is not at zero risk from the adverse effects of the vaccine, including what's been well publicized and is actually on the package insert now, which is myocarditis, myopericarditis. We also have a vast pool now of kids, like the rest of the country, who have been infected. And so the only randomized trial data that we have, this is what actually granted Pfizer their emergency use authorization, in the 5 to 11-year-olds, showed that even this limited data that they did collect during the randomized trial, which is about 2,300 kids, was that the kids with a previous infection, these are 5 to 11-year-olds in the Pfizer randomized trial, none of them even got an infection. And what were the infections, after all, in this randomized trial? They were sniffles. There was not a single serious case in the entire cohort, regardless of whether they were vaccinated or not. So for this type of fear mongering, when we know that one of the mercies of COVID-19 is its extremely limited impact in the pediatric population, this is just wrong. I'm sorry, you have to call it what it is. This is just wrong. We have a very low risk population. We have a lot of kids who've already had their mild infection who are naturally immune, and the idea that it's a priority to vaccinate healthy children, it's just wrong.
Dr. Bostom, on that point, and on a kind of a personal angle for me, I actually was at an endocrinologist with my child in the last week, and totally unrelated issue, who asked about the COVID vaccine, and I began to have a conversation about whether children should have it. Was not really interested in making an argument, and her primary case for my children getting a vaccine is, well, they could spread it to other people. Is there support for that?
No, it's another logical fallacy, because even Dr. Fauci of all people admitted in a New England Journal of Medicine editorial last week that vaccination is not preventing transmission. And particularly with Omicron, I mean, that is the most striking example of vaccination not preventing transmission. I mean, 83% of the cases in Denmark were amongst the fully vaccinated. I believe in the small sample that Dr. Walensky presented last week from the CDC's first survey data, the initial, I think it was 43 cases, 34 of them were fully vaccinated, and that included people who had been boosted as well. So no, it's not the vaccine. Again, even the vaccine zealots are acknowledging now that it's not preventing transmission. The question is it going to prevent serious morbidity and, God forbid, mortality in those that are high risk? There are some observational data that suggest that is indeed true. However, even those data, I mean, they're limited because again, the basic problem with these vaccine rollouts, and it's not just the coronavirus vaccine, is that you have to go all the way back. The last time we actually had a mass randomized controlled trial with vaccination, and in this case it was childhood vaccination, was the polio vaccine trial of 1954. That was a trial of 1.8 million in the randomized trial, where we actually had data on preventing paralytic polio. There are no vaccination trials ever since where you actually looked at clinical outcomes. The only measure that is gauged to grant these vaccines approval is whether in the near term they prevent infections. So yes, I would certainly argue that in the nursing home population, in the elderly high-risk population, we at least have some observational data, again, not within the randomized controlled designs, but we have some observational data to suggest that those high-risk persons may be prevented from having severe, morbidity and mortality. But again, it's not the best data because it's not within the randomized controlled trials. The randomized controlled trials never addressed those questions. Again, we'd have to go all the way back to the polio trials to see that kind of evidence. We
got about 45 seconds. When does this end?
It ends when we say it's going to end, and maybe Omicron. I'm not cheering Omicron on. It still is going to probably cause some serious morbidity and maybe some mortality in some high risk populations. But it is clearly behaving at this stage as the most benign variant that we've seen thus far, and it may confer enough additional immunity to help us get to the point where the serious morbidity and mortality from coronavirus will be abated, and that's what I pray for.
That's what we all hope and pray for. Dr. Andrew Bostom, thanks so much for your time today.
Thank you.